Hi, I'm Isabella Galichia.
And I'm Dr. Jody Galichia.
And in today's video, we're going to be talking about palliative care and heart disease.
Well, palliative care means a way of just sustaining the individual with heart disease. In other words, managing the symptoms without perhaps doing some major procedure like surgery, maybe not even doing a heart cath. So looking at the situation and saying, well, there's nothing here that we can do in a dramatic way to change this around. And sometimes palliative means, well, you're kind of beyond the ability, you're older, you're sicker in other ways, and we can't really do anything dramatic to turn this around and treat you. But it also means just taking care of your illnesses. In other words, you know you have heart disease, so what do you have to do if you're not going to do something like a stent or a heart cath or surgery? And that includes keeping your risk down, keeping your weight down, exercising, taking medications to lower your cholesterol, lots of things that your doctor can help you with that in a very simple way can keep your risk down, because that's what you're trying to do, is lower your risk. So palliative care, in my opinion, is very, very important. Now, does it mean that you've given up on this patient and saying, well, can't do anything for you, all we can do is palliative care, or just kind of take care of the symptoms the best we can? No, what it might mean is that we're going to take care of these symptoms the best we can now, and if we have to, we'll proceed towards something more dramatic like surgery.
So if I had a friend or loved one who was in palliative care, what would be some of the questions that you would recommend to ask their doctor?
Well, I think one of the questions would be, how much trouble do you have breathing? Because breathing becomes a big factor when you're dealing with heart failure, and especially if you're dealing with heart failure, which has progressed to the point where you really can't do much surgically. In other words, sometimes patients reach a point where there's not a lot you can do. But medication and diet and maintaining a low salt diet, for instance, might be very, very helpful. So I think the question always is, what can I do to slow this process down? And families can ask that question, and certainly patients need to ask, doctor, where am I? What can I do to keep this disease from getting worse? How can I extend my life by taking better care of myself?
Thank you. And thank you for watching this video, and be sure to visit hearthealthcommunity.com to learn more about palliative care and heart disease.